Good afternoon and welcome to yet another Government of Anguilla's press conference. It is my pleasure this afternoon to get the ball rolling. The Premier is a little tied up at this time. He has sent his apologies. He'll be with us as soon as he can. So we're going to get the ball rolling, and the other ministers will join us as quickly as they can. So, dear Lord, we give you thanks and blessings for yet another beautiful day, another day of life and hope. And we ask your blessings upon this session this afternoon, that you may guide our thoughts and our actions as we discuss the important matters affecting this nation. We ask these blessings in your name. Amen. So I want to say a pleasant good afternoon to our Parliamentary Secretary, Mr. Foster Rogers, and our Chief Medical Officer, Dr. Aisha Enduin. And we're going to get the ball rolling by turning over to them to give us the updates.
Good afternoon, everyone. So we sent the press release a couple hours ago with the most recent figures since the last release of, was it Friday, right? So as noted, we confirmed an additional 16 cases. Without repeating the contents of the press conference verbatim, what we are seeing overwhelmingly is a lot of household transmission. So you see that 12 of those 16 were through household contacts of some kind, form or the other. 9 household contacts, 3 so-called social contacts who are in the homes frequently or otherwise. What we are seeing is a lot of these multi-generational families where you have the children affected and the elderly persons affected as well. As you know, that the children in a peculiar group because they're not eligible for vaccination at this time. So this is the kind of thing we've seen play out in other countries where this is where the epidemic is kind of taking its foothold, making its foothold. We also had a fully vaccinated adult resident returning from Jamaica who tested positive on arrival. And then most disturbingly, on the weekend, on Saturday, we had somebody turn up here without approval who turned out to be positive. Not only that she turned out to be positive on tests, but on further probing and so on, she actually had a positive PCR result from a couple days before. She got through, she was traveling from the US to St. Martin with a negative antigen test, and our PCR test was, of course, positive. So a lot of things to say about that. And unfortunately, that was the third person to turn up on Saturday without prior approval. We have to plead with all involved. The protocols are there for a reason. This is a very kind of situation we want to avoid. Yes, people may come and test positive on arrival or later, but you are looking at the first line of defense. If persons are infectious and positive, don't travel in the first instance. That's the point of that. If you break down that barrier, if you let people slip through, it defeats the purpose. And now we have somebody who turned up who's positive and knew she was positive before traveling, right? So we're going to tackle that, and we have to penalize all those involved because we cannot let that happen. I know of some horror stories from neighboring territories where that becomes frequent if that is allowed. We couldn't even send the person back because at that hour St. Martin was closed, and of course if you knew that a person is positive, for sure, of course you would not be having that person travel back to the country of origin regardless, right? In the past we've had to send persons back because they didn't have the proper approval, and we didn't assess them at our ports of entry. But in this situation, knowing her status and the hour, we were stuck in that with that situation, as it were. Then very early this morning, we had an unvaccinated elderly gentleman in his 90s, in fact, who turned up at the hospital, and he was hospitalized in a serious condition. He's doing a bit better right now, and in addition to his age, he has at least one of the underlying conditions for severe COVID-19, so we have to watch that very carefully. And he is one of the persons we're just starting the contact tracing. Again, you have this multi-generational family. He has 13 contacts between 2 homes, 9 in the homes that he lives in, including several unvaccinated minors. You're hearing stories of symptoms compatible already in the previous weeks among persons resident in the household. So not to preempt, but just one of the things we've been saying, if you're in a household, mixed vaccination status, big households, lots of children involved who are not vaccinated, and you're having symptoms or not, you really should start to think about managing your environment. Because really and truly that's a difficult sort of scenario for our government to manage. You're going to have to look at what you do in the households. And just to reiterate, this was found as a loophole a long time ago for other countries. This is what they were seeing. You're doing well outside, you're doing your distancing, you're limiting your mass gatherings, you're doing mostly outdoor events, and then when you get into the home, you are dropping your guard. And that is exactly what we're seeing here. And then of course, we had a fully vaccinated male resident with no history of travel. We're literally just getting that information. More than half of these cases were between Sunday night and this morning. So really and truly the contact tracing has just begun. We have people recovering all the time. We'll have a few more recoveries for you by Wednesday, most assuredly. And so that brings us now to that count to 217 having been confirmed since this pandemic started, and 38 of those are considered active at this time. So I'm going to take a little pause there in case there are any questions.
You mentioned you mentioned children being in contact with it. Now, I noticed in the US, they've had a lot of children who have been catching this. Now, the government was looking into bringing in Pfizer for our children. What's the latest position on that?
Again, we are really beholden to when the powers that be who have the medication, have the vaccine, decide on the protocols that are appropriate. I will warn you that in our last discussion on Friday, they were saying, even in the UK, the thinking is that because historically cases are more mild in children, they are even looking at in their populations, looking at, in the first instance, children that are the most vulnerable. We're not sure how that will play out in our settings, because if they take that approach, it's going to be similar for us. It might complicate things in the sense that our numbers, I'm not sure how that will affect the logistics and the numbers, because our vulnerable population is going to be a small number. So all those things will have to be taken into consideration. I'm sure when they roll out whatever they roll out, it's not going to be just for Anguilla. It's going to be for all the UCOTs that do not have access to Pfizer yet. So the short answer to that question is we just have to wait and see. They're treating it with equal importance. You know, the UK has come through for us before, but I'm just sharing with you some of the technical discussions that are going behind what they'll decide and when they'll decide it. But it's really not up to us. And I do believe that whatever happens will be in the best interest of the population. And they were saying that you remember that every policy decision that they make may not be exactly transferable 100% to our settings. So that's going to be something we have to sort of figure out in the short term. But just to say that that's very much on the plate. We talk about it every week, and hopefully in the next few weeks we'll have some solid steps forward.
Thank you, Doctor. If we take an analysis of the past months, May was the time when we were ending the big cluster. Then June, there was harder case. July was good enough. Mm-hmm. Why do you think August was such a busy month now?
Well, you could see the distinct difference because of the Delta transmission. And incidentally, in the last statement from the governor's office, we did confirm Delta. And we expect most, if not all of these, will be Delta as well. It's changed in terms of the infectiousness. You're seeing that every plane ride has somebody that is infected and fully vaccinated or testing positive a couple of days later. So it has changed things a bit. But we're still looking at mild to asymptomatic infection because of vaccinations. That's still happening as well. So that's a big reason. We've also, as we reverted to some of our public health measures because of Delta and because of what we're seeing, as you would note. So we're hoping that this trickle or this situation, we have a few more weeks of this. We expect a couple more weeks of this. And with the other measures in place, we are hoping to go back to somewhere close to where we were before this surge of increasing cases. And that said, you will notice and hopefully you appreciate our efforts not to do things exactly as we did before we had vaccination in place. So we're also juggling that as we try to sort of navigate the new way forward with Delta and how we'll sort of coexist a bit better with the virus without putting our population at risk.
So are you saying that all of the cases right now are related to the Delta strain?
We believe so. I mean, in terms of the viral loads, in terms of the evolution and so on. Remember last time I said with confidence it's Delta? Well, 3 of them were Delta, 3 of the 5. We're going to send some more this week, and it's Delta until proven otherwise. It's a clear, distinct pattern in terms of the CT values we see. It's the lowest we've ever seen, which is like the highest viral loads ever, and the way people are responding, you know, taking a bit longer in the unvaccinated. Like I gave you the example of the teenagers a few weeks ago compared to the gentleman who's decidedly old and he was like moving through it quickly. So it's hints at Delta, and that is the pervasive strain everywhere, at least in our markets that are coming to us and the places that residents are returning from as well.
For some weeks before this latest surge of COVID, the government was saying that frontline workers in the government and hotels and so on should be vaccinated. Now, it was never mandated, but my question is, in view of all these extra cases and so on, is government making any regulations on those grounds? I think I don't know, not I think, but fully vaccinated people should be sure when they go to the post office or they go to a hotel or a restaurant or they go to pay their property tax, they should know that they're being dealt with by a vaccinated person. Now, I know that you will say, okay, you're not going to get very sick, you're not going to die, but at the same time, there should be some kind of consideration, I think, for vaccinated people, and especially in view of the latest research in the UK, which says that after 5 months, AstraZeneca and Pfizer start to wane. We're getting close to our 5 months. So my question is, what is the government doing about these issues that I've raised?
Government?
Thank you very much. That is the question of the day, isn't it? We are actually keeping our eye on this. It is not something that is being brushed under the table. But we, of course, when we recommend something, it's always in an incremental phase and in a way that can stand constitutional scrutiny. Because at the end of the day, we are a country of laws, and we have to make recommendations based on the current state of play, so to speak. So we are looking at this very closely. We are keeping an eye on this. In particular, what we may do initially is to look at those persons dealing with vulnerable groups, children, persons in senior citizens' homes, persons working in the health sector, persons in daycare, persons teaching in school, and those type of things. So we are keeping an eye on it, and certainly it is a decision the government will take if and when necessary.
Thank you.
Yes, so the Permanent Secretary is right. We are discussing this, and we have been. The Attorney General's Chambers is looking at regulations. And certainly what would be considered is, persons who are working among those who are vulnerable, the elderly and children. So like teachers, policemen, fire, those working in the elder care homes, healthcare workers. And no, I think that you do have a point. So if they're not getting vaccinated, then we are looking at weekly testing at the person's expense, because we feel that this is the only way we can protect the population, and I think that it is something that we need to be considerate of. And as we move forward, as we see how things, the epidemiology, the penetrance in the community, then we will be making those determinations.
A couple easy questions. You mentioned one person plus, I think, 2 more, so a total of 3 that have come into the country without clearance. You talked about penalties. Could you just go into a little detail about what the penalties are? And I mean, that is the showstopper if that's not handled correctly. So if you could just talk about how that's actually even happening and what the penalties are, please.
Well, typically you do an investigation, and once you find that persons are culpable, I believe the fines go up to 38,000, right? Plus or minus jail time. So it's just going to be based on the results of investigation, and we're following that up because it's just happened Saturday and Sunday. Saturday, we were notified that at least that was the 3rd time it happened for the day. And of course, unfortunately, this person was actually positive.
And the other question is, the 3 people, are they residents or were they visitors coming in from the U.S. to residents? Thanks.
Yeah, certainly this is concerning. We have always indicated that it seems as if Anguillians think the laws of physics and the laws of everything change in the middle of the channel between Anguilla and St. Martin. We tend to abide by people regulations when we're overseas. We tend to follow people regulations when we out of the country to the T. When it comes to coming back home, or it comes to being in Anguilla, people feel they can sometimes do what they want, and this is not the case. We have measures in place for COVID because it is a pandemic. It is an international disease of concern. it is a problem that we're trying to manage the best we can. I can tell you offhand, we have so far stopped about over 60 persons from coming to Angola because of positive tests, right? Either positive tests that we identified prior to coming, or positive tests that we would have identified after asking them to do a PCR from a rapid. Some persons would have tested negative on a rapid, and then we asked them to do the PCR, they're positive. Because certainly the PCR is the gold standard, and of course the rapid is a valuable test when you need quick results to get a sort of snapshot of what's happening in the country as a screening tool. But it doesn't have the sort of sensitivity, and when we say sensitivity, we mean the value of positive cases it can pick up that are truly positive. The sensitivity of the PCR can be up to 98%, 99%, whereas for rapid tests, it can be as low as 6 to 70%, depending on the rapid that you use. So whereas with a PCR, you miss 1, 2, maybe 3% at the most, for a rapid test, you can miss up to 40%, depending on the test that you use. So that is why we always say RT-PCR. And while other countries have moved from PCR, some countries are accepting antigen tests to come in. We have not moved because of the size of our country and because we cannot afford to miss 40%, even 10% of positive cases. And that certainly will impact the country negatively. So while some people have criticized us for sticking with RT-PCR, we have done that for a reason, because it gives us a good measure of positive cases. And we see it's borne out every day. As I mentioned before, there are persons who would have tested negative, which would have showed us a negative antigen test. And then when we say, no, we want a PCR, they go back into the PCR and they're positive. All right? So we implore Anguillians, if you know you're positive, do not get on a plane. You're risking other people's health and safety. So if somebody would have tested positive, would have jumped on a plane, come to St. Martin, not only that, jump on a boat and come to Angola, that is really somebody who would have thought this through. This is not a mistake. This is somebody who would have thought this through and decided to proceed nonetheless to come to Angola, risking the safety of other persons. And certainly, from a Ministry of Health standpoint, from a government standpoint, this is something we cannot abide because it shows a total disregard for the health and safety of other persons. It's just something that's unfathomable. So just to pick up on a couple of things that Dr. Aisha raised, this travel to Angola without approval is illegal. It can, you can be fined through the courts and also imprisoned. And certainly this is something that we'll be looking at in these cases as well, because we cannot allow these things to happen again. It is not only difficult for us to abide with, but it's also dangerous to persons coming to Angola. Vaccines should arrive tomorrow. 240 doses of vaccines will arrive tomorrow afternoon, 4 o'clock from Antigua, from the UK via Antigua. And we will start doing second doses on Thursday, which is the 3rd. So a person will be contacted. They'll be done at the clinic, in particular Welch's Polyclinic at this point in time. And we will let people know when they can come for their second doses. We do have the survey on the beatcovid19.ai website, where persons are invited to go and register the interest to get the vaccine for the under 17, between the ages of 12, 13, and 17. We are gauging interest. Certainly, we are looking at ways of protecting our younger population, and if we can get the interest there, it'll put us in a better stead so we can know how many doses to get, if indeed when they're ready to get those doses. So it's at beatcovid.ai, beatcovid19.ai, sorry. There's a survey there. You can register interest to get the vaccine for your minor child between ages of 12, 13, and 17. We wanted to address the cost of incoming tests for the 4-day quarantine. This is not a cost of quarantine. This is simply a cost of the tests. And it has been extremely expensive. Tests are very expensive. Tests are very, what should I say, critical in our protocols to ensure Angola's in safety. Angola is safe. But we will need some assistance in this regard. Most of the cost of a test is borne by government. The $100 is not even the cost of a test. It is a highly subsidized cost, and that $200 is to clear the cost of your incoming, your arrival test, and your quarantine, your clearing quarantine test. So it's $20 for the test, $100 for each test. It's the cost is just phenomenal. We have just had to import 9,000 swabs, which is a swab basically can cover a month of tests, and these 9,000 swab cost us almost $25,000 US. And this is just the swabs that you put in your nose, and that's a month's supply, and that's not even considering the gifts, the gifted packages of kits that are sent by the UK government on a weekly basis almost for both the open and the closed platform to actually do the PCR tests. So we're asking persons to understand that this is not a cost of quarantine. It is not even the full cost of the test. It is a highly subsidized cost of a test that we ask that you understand is basically for us to keep Anguilla safe. The final point I'd like to make that Aisha brought up earlier, Dr. Andrew, is household transmission. We did mention a couple of weeks ago that particularly in multi-generational households, that persons please use their masks inside the homes for a couple of reasons. And now we're seeing it borne out in terms of transmission between older and younger generations in the household. The younger generations, of course, move about more quickly, go through the country and so forth, can bring things home. The older persons in the 80s and 90s are mostly homebound. Some are in their beds. So when you come back home, please ensure that you protect each other. And while you're in the households, to ensure that there's a way of using your masks in a very responsible way, that even if you're positive, is very unlikely, or the transmission scenario is less likely to older persons. So we want to implore persons to wear their masks indoors, not only in public places where the law requires you wear masks indoors if you cannot social distance, but in your house, if indeed you have multi-generational households, to ensure that we protect each other.
Yeah, just a couple of very important points. We received a donation from PAHO on Friday, to the tune of 56,000 US, 5,000 and something, almost 6,000 antigen rapid tests, and also 15,300 swabs and viral cults transport medium. The ones that Mr. Rogers were talking about are so expensive. So thank you so much to the Pan American Health Organization, and thanks for that reminder. It would have been remiss of me not to mention that. So a big donation from PAHO has been a stalwart support from time immemorial, really. Just a couple of points with the intergenerational kind of spread, multi-generational. We're actually seeing instances, not just out of the blue, where people in the house are symptomatic. So please pay attention to that. Even if it's mild symptoms, pay attention to that. We know it's a tough ask. You're in the house, you want to let your guard down, but more and more and more we're seeing, in every case, somebody was symptomatic before. It's a runny nose, it's a slight cough, and the person that's presenting, like in the case of this gentleman, was not the first person sick in the house, so please pay attention to that. And we have persons with florid symptoms from the weeks before, not severe symptoms, but maybe they didn't pay attention to it, and now he's at the hospital. So that's really happening a lot. I was asked to address the question about the boosters. Actually, the last word we had from the counterparts is 6 to 8 months to consider the waning of the vaccine, and of course, the research is still out on that. They're going to finalize and come up with more robust data and recommendations. So we're looking at a 6 to 8 month interval. So we're looking at around December if we need boosters. And of course, the discussion is, will everyone need a booster? Or is it just going to be, in the first instance, those who are vulnerable, persons who may be immunosuppressed for one reason or another, persons with underlying illnesses? So that's the kind of discussion we're having. We just have to wait for the guidelines, but we are discussing it and even looking at the numbers, country by country, who is going to need the booster. So again, we're looking at end of December to early January, and we're already discussing logistics and so on around that. I think there were a couple other questions. One that keeps coming up is if we thought that the carnival played a role in the spread. What we have seen so far, even in the instances where we are not detecting the source as yet, these are not persons that attended any of those mass events, especially the outdoor ones and so on. We've said outdoor spaces are protective. It's not impossible because a lot will depend on the nature of your interaction, but not the mass events associated with carnival. What we believed happened in the face of the variant was that we weren't quarantining anymore, and persons would have come into the community, in the households, and they would clearly introduce the virus at more than one point, most likely. So that's the feeling on that. With that, I will ask persons, another very, very critical part in this fight is when we suggest things or make recommendations that people are not happy with. We are looking out for the best interests of the country. It doesn't help when persons take it to say, oh, we're anti-ANGUILLA or we're treating people differently. That's very important because there's a lot of pressure to bear when you get that sort of negative feedback from the public, and sometimes you get pushed into decisions that may be not so helpful, because we would have wanted to keep the quarantine maybe a bit longer and so on, and with those kinds of pressures in the face of a very, very infectious variant, that's where you get the possibility to introduce disease. So your response, your support or lack thereof is also instrumental in the fight. There are a lot of pressures to bear. We are not in an enviable position. Nobody in public health is happy that I know, no counterpart. This is not a nice job right now at all. So please just think critically. Look for alternate explanations. Ask, don't accuse, don't go on social media and rip people apart. We're human beings too, and it's not easy. Some of us don't even look at social media anymore because of the psychological impact. I'll be very honest. So just bear that in mind because that's part of the fight as well, right? People are asking, since vaccinated persons are getting COVID, should they still get vaccinated? Yes, because we're showing countries like Iceland and the US and showing there's a big difference between who's vaccinated and who's not, right? God forbid we start to see big numbers, you're going to see that dichotomy of persons who are vaccinated showing very mild illness versus those who are not. You see the statistics from the US where it's really a pandemic in terms of severe illness and hospitalization and death of persons who are not vaccinated. You're seeing in Iceland, even when Delta is ripping through the country, they're not having people die, they're not having people turn up at the hospital. So yes, absolutely, this is a proof, that the vaccination is working. Even our numbers should be much higher for what Delta is. It's supposed to be infecting one person, it's supposed to be infecting at least 7 to 9 persons if they are susceptible. So we're seeing something playing out. We're seeing the role of the unvaccinated even in the households with the minors in terms of getting the disease to spread. So there's lots of evidence there to vaccinate. And it's your choice, So you have to decide where you want to be in this fight, and you have to make that rational decision. And we cannot thank those enough who moved, and we have a decent coverage, and I think that is playing out a lot because we have around 60% easily. That is definitely making a difference, or has made a difference.
Additionally, we are not able to send every sample to UE for sequencing. I think we only allowed 5 per month, 10 per month. So it is not every positive sample that we can send to UE for sampling, for sequencing. So we do on an occasional basis, we pick and choose based on our experience which one we should send. Because certainly it gives us an idea of what's happening in the community. So when we say we got 3 positives back for COVID, for Delta last week, then we have a pretty good idea that Delta is already in the country. And certainly that is probably the reason why we're seeing the numbers that we're seeing in terms of vaccinated persons. But certainly the numbers that we're seeing, because the population is vaccinated, I think is still quite heartening. If you just follow on to what Dr. Aisha said just now, if you were to look at what happens with Delta in an unvaccinated population, one person can infect up to 7 to 10 persons in the unvaccinated population. You're not seeing that happening in the vaccinated population at all. You're not seeing that type of massive spread. If you were to remember, when we had our outbreak back in April, we had 70 cases in less than a week. We were ramping up like 20-something cases a day, certainly. That's not happening now at all. And even though it's Delta, it's still not happening. And the reason why that's not happening is because of the high level of vaccinations that we have. Now, Aisha also alluded to the fact that sometimes we make recommendations that people are not happy with. But we make recommendations based on the risks that the transmission probability poses to the community of Anguilla. And we will assess these risks to determine the balance between livelihoods and the disease transmission. And I keep saying on a daily basis, the economies of the countries are critical for us to keep going, while at the same time we keep an eye on the transmission pattern of the country. So it's critical that we look at that. And one of the risks that we have really looked at and we have really tried to manage is the difference in someone who is staying at a hotel as opposed to someone who's staying in the community. And we've brought this up more than once. It's a total different risk we're looking at. And we manage that risk in the best way we can, because someone who's staying at a hotel is not necessarily going to go to church, going to come in the middle of the community, going to go into the the supermarkets, not going to come into schools and those type of things on a regular basis. That is a different risk compared to residents who come back into the community, who are really injected themselves into the community at large. So we looked at the risk, and certainly we balanced that risk against trying to keep an economy open in the middle of a pandemic. So that is why we had to make those recommendations, and that is why we stick by that recommendations, because we're seeing it playing out. We have never seen an outbreak of COVID in Angola from the hotel population. We haven't. It's the most tested groups that we've had since last year. In fact, as I mentioned in one of our previous press conferences, we did almost 38,000 tests in Anguilla since last year, and the bulk of those were in the tourism sector. So yes, we look at risk. Everything has a risk, and something we have to accept certain risks, and we are willing to accept a risk of persons come to the hotel, while looking at the risk of people coming into the community a little differently.
Standing here, you answered most of my questions. However, you've made mention many times of mask. Now, the question is, are masks dutiable here? And if they are, will duties be removed from masks if duties are paid on them so that they can be easily had by all?
Yeah, I mean, masks were duty-free along with other items pertaining to COVID. So I'll have to check and see if those expired, but certainly we have, that was so before we came in, we continued it, and I'll just have to check and see if it's expired, but that would be the plan, to make those duty-free.
I have a couple questions. Mr. Rogers, I was going through Executive Council minutes, which was published last Monday, dated August 11th, and it mentioned that the Delta VOC has shifted the herd immunity requirement to approximately 80% of the population. In Anguilla, about 25% of the population are not eligible, which we know referring to children. So I'm just wondering, now that we're about to immunize children, will this bring us closer to herd immunity?
Yeah, what we were saying in the EXCO minute is that all the discussions pre-Delta, looking at herd immunity, the possibility of herd immunity, was putting it an estimated around 70%. That has certainly changed just because one person is now infecting 7 to 9. Part of the herd immunity assessment has to do with how infectious that agent is. For example, the worst case scenario, like a measles, where one person infects 18, you need 95% of your population vaccinated against measles, right? So we're saying in the first instance, we can know off the top of our heads, just because of how infectious it is, that bar has been shifted. And you will note that in some arena and some discussions, they're even saying, well, it's acknowledged it's become more elusive. Some persons are saying, is it even possible in the traditional sense, you know? Just for us to move, we're saying that was always a minimum. We set at 70%. Get out of your mind. We're just saying everybody that needs to be vaccinated and can be vaccinated should be vaccinated. So that was the sentiment of that statement there. We're looking at trying to vaccinate the younger population, younger and younger, as soon as possible. But you know, some of the constraints that we spoke about, it's going to probably for the foreseeable future a juggling of the vaccination measurement movement, and also some of the public health measures that will have to be kept in place. One of the biggest things that we could go back to possibly is to go back to no transmission. When you don't have the virus circulating in your community and so on, it changes the game as well. And your best defense is not to have it introduced at all into the environment. You see the challenges we have, right? So we're trying to roll it back to something like that between vaccination and the new restrictions in place to stamp out what's going on right now and then start over again from there.
We know the online survey was launched last week. Are you all able to gauge the interest already?
We have seen some interest. Of course, we're not ready yet to report it because we're still waiting. But yes, we have seen some interest of persons indicating that they would like to have their young children vaccinated.
Okay. Going back to the Executive Council minutes, it made mention of the recommencement of day trips to French and Dutch St. Martin, obviously depending on the situation, but it did mention St. Martin. So is that still the plan, or has this been delayed?
Well, we're still looking at it. The challenge we're having is that some of those countries that we're looking at for day trips are themselves having difficulties and emergencies. So we would have to be very careful that we do not send our people into a situation where themselves are getting into emergencies. So we're going to look at it again, but certainly it can't be something that we just make a quick decision on. It's a decision we have to make based on ensuring that where they're going to are relatively safe, because no place is 100% safe. Coupled with persons who are vaccinated, coupled with the protocols on the vessels that are very clear for both the crew and the vessels themselves, coupled with probably a little, well, not coupled anymore, because we put 4 together, it's no longer coupling, it's quadrupling. Possibly a short quarantine of a day or 2, we don't know yet, but those are the things we're looking at upon return. But no, we haven't made a decision as to what date yet for that.
Okay. So this would also include like the protocol of the movement for the ferryboat operators?
Yes, it includes protocols for the ferryboat operators, protocols for the crew, protocols for passengers traveling, and protocols for passengers returning.
And just my final question as it relates to the female who arrived in Anguilla without prior approval. As far as I know, investigations are ongoing, but I'm just curious as to just to find out if penalties can go as far as probably penalizing the airline and the boat.
Yes, current regulations in place allow us to penalize agents, vessels, captains, and owners of those. Yes, so we can do that, and more than likely we will look into those as well.
One final question pertaining to managing risk and dissatisfaction with some of the actions that are being taken. I've heard, just wondering about the maximum number of people in churches who can meet in churches and in restaurants, 25. And the question is, there are some churches that are 3 times the size of other churches. There's some restaurants that are 3 and 4 times the size of some teeny-weeny little restaurants. So when you say 25 max across the board, it seems unfair to those establishments that have bigger space. So I'm just airing that, seeing if you could address
certainly.
it.
And we recognize that, but I think what you have is a small health system, a small regulatory system, and to manage the policing of different tiers of different organizations, depending on size, is a nightmare. I mean, when do you decide which church has 50, which church can have 25? You know, we understand it may be a little difficult for everybody to be in the same pool right now, but because this is for 2 weeks in the first instance, it was something that we had to manage, and had to manage rather quickly with limited human resources. So that is why the decision was taken in a way that allows us to police it rather easily. What I must say, though, is we still have some concerns about the persons who are not wearing masks, and in very close quarters as mandated by the regulations. We want to press and stress as much as possible that if you're in an enclosed area that cannot lend itself to social distancing, in fact, if you're in an enclosed area at this point in time, you should wear your mask. In particular, when those areas don't have proper ventilation. If it's closed and air-conditioned, you need to wear a mask. And certainly if there's fresh ventilation passing through, then that can be a little less problematic. But nonetheless, once you're in an enclosed area, at this point in the law is clear, you must wear a mask.
Sorry.
Just to clarify, and I understand you said, certain things had to be stipulated quickly. So there is a possibility that may be relooked?
Well, we look at these things on every 2 weeks. Every 2 weeks we look at them, and depending on the situation, we can make changes.
Just to add, before you go on, Brenda, that you mentioned the different sizes of establishments. There's also part of that regulation that say if you can't social distance at least 3 feet between persons, that it could be less than 25 in an establishment. So that will also be policed.
When you mentioned investigating these latest cases, it reminded me that back in April, we had up to like 95 cases, I think. Now, we don't have any police commissioner here, but I haven't heard anything about those. Did they ever go to court? Were they ever charged? Does anybody know?
Those were being worked up to be prosecuted. So I don't know how many have been at this point, but certainly I know that the commissioner had sent them on to be to go to court.
I did ask last week in reference to a fresh supply for persons who would have signed up for the first time. What's the position on persons who sign up for the first time as adults for the COVID vaccine, and when will that be initiated?
Yeah, we have been still driving persons to the vaccination the vaccination portal to keep registering, and some people have. The 240 doses we have coming now are enough to cover all the second doses for those persons who have gotten first doses in July, and some extra. Certainly to be able to give to some persons who may want a first dose, but certainly the priority at this point in time is to give second doses to those persons who would have indicated that they had a first dose. But we still do have the portal open, and we are asking people to still register there. But the 240 doses right now we feel can cover those who need second doses, and when we did the numbers, plus some extra first doses.
I have a question slightly different, but Mr. Rogers, I know this fall under your portfolio still under health. So on the governor's page that we had 2 Public Health England prison healthcare specialists visiting HMP, so I'm not sure if you're able to give us an update on those discussions or engagements.
Well, we're doing a health needs assessment. So they're going to supply the report. They left last Saturday, I believe, but we were tied up with all this stuff that was happening at the time. But no, we had been planning it for some time. Health needs assessment, looking at the needs of prisoners, especially when they go back into the community, and look at how we could, the continuity of care and those and things like that. So looking at mental health issues and chronic disease and so on and so forth. But we don't have the report, but once we have the report, we'll share the main findings. That should be within the next 2 weeks available.
The question again on the person who came in with a positive test. What indication did you had to prove that the person was positive before he came to Anguilla?
The date of the test, because actually the person was not forthcoming. She had made excuses that she couldn't download her stuff off the internet, and the nurse said, well, let me give you some data. So she had the rapid test in hand, which is not our standard. And when the nurse pressed her and she showed the test, it was a positive PCR test from a few days before. And of course, we sent her sample and it's positive.
But she didn't apply to Anguilla.
She applied on the portal, but of course the last step before approval is submitting that negative PCR test. So she never submitted a negative PCR test because she didn't have a negative PCR test.
Okay.
So she came through from the States, she got as far as St. Martin on that rapid, and then she turned up here without an approval, and then tried to make excuses as to why. Because we've done that before. A couple of times people have been able to show that, and we said, okay, this is not ideal. It's late, you don't send people back if you don't have to, but they've actually had a test, let's say, right? That's to be discouraged as well, but when she produced the test, it was a positive test outright from 3 days ago.
Okay, thank you.
Just one final statement, I think, before we leave Premier. We do encourage the public to try and, as best as possible, follow the protocols. We know it's difficult. It's been, December is going to make 2 years since we've been on this, and as you can see, the health team is getting tired. I have to give one of my senior staff vacation next week because she is at a point where she's been burnt out, and this is one of the senior members who these are all the testing and surveillance and quarantine. So we actually the community to bear with us. We know it's not easy, but it's not easy on us either. It's difficult making these tough decisions and making these unpopular decisions. I don't think there's any PS who would want my job right now. It's 7 permanent secretaries. I can guarantee you I couldn't pay any one of them to become permanent secretary of health right now. But we want you to bear with us. We're trying to do the best we can in terms of to ensure that we keep Anguilla safe, even in the midst of positive cases in the community. But we ask you to try to stick to the protocols, try to be as safe as possible. And we know it's not easy for human beings to be locked down and wear masks and stuff. But if we can get through this difficult next few weeks, I think we'll come out better on the other end.
Foster, you may not think you're appreciated, but quite honestly, all the time when you're out there in the community, people are saying the health team has done a fantastic job. Definitely. So you really are appreciated.
Well, thank you very much, and I must say that we've gotten a lot of support from the Executive Council. I mean, it is, at the end of the day, we can make as many recommendations as we want, but we have to get the support from the Executive Council to make the tough decisions and to implement them. And we want to say thanks to the Premier and certainly members of EXCO for working hand in glove with us to ensure that we develop a proper product to the people of Anguilla. It's been a tough job, but we've had a good working relationship, and I want to thank the government for bearing with us, because Aisha can be very tough when she's ready. And we often have to play good cop, bad cop in EXCO, but at the end of the day, I think we try to come to a decision that makes sense for Anguilla and that we use to protect the people of Anguilla. Thank you.
Thank you very much. I think that you guys have done a great job and continue to do it, without a lot of fanfare or recognition or appreciation. But as Brenda said, the community appreciates it, and that's what makes it worthwhile, that you'll reap your reward elsewhere. Yes. So thank you very much. Appreciate it. All right.
Thank you very much to the health team. And now we're going to continue with the other sectors. Parliamentary Secretary. Okay. All right. Are there any questions?
Yeah, I actually
Yeah.
I have a question, and it's based on assumptions. So, and I'm assuming, but it may not be a correct assumption. I'm assuming that right now, visitors to the island, the numbers are starting to decrease. So as the numbers decrease, I'm sure your office is also looking at fine-tuning processes and how to better manage what we just talked about, the testing, so on and so forth. The portal itself, I know there was talk that it will continue in October. It had been said that it would go away, but based on the Delta, it's now going to continue. Will it continue indefinitely? And if it does, will the portal process become more automated, or will it still be a human-driven enterprise?
Thank you for that question, those questions. Definitely nothing is indefinite. With COVID, we've always set dates in mind, and as the time approaches, we would look at the situation and see how things are and then make decisions from that. So you would know previously from April, May, our protocol had the portal expiring at the end of September. And in October, we anticipated persons once they are vaccinated. Actually, no, at that point, we would have had anybody coming into the island. They would just come in as usual. As you see right now, this can arguably be called the worst part of the pandemic because each day we are making new records, and internationally you're seeing more persons being infected daily than ever before, and the numbers are climbing. So we are at another point in the pandemic where things are very difficult. And with the introduction of the vaccine, you can see we're almost where we were last year in terms of the global situation, but we were able to respond differently with a significantly shorter quarantine time and having a portal that is more automated but still manned by human power. The reason is that our entry protocols are tough, they are tight, and they are there to ensure that no one skirts the system and that each applicant has an opportunity to have the application reviewed by the experts and those who are trained by the experts. So for now, we intend to have the portal active until the end of the year, and then again, perhaps November or so, we look to see where we are globally and see if it makes sense, because while the situation in Anguilla might be improving, that might not be so for the rest of the world. And the portal is our first line of defense for our interaction with the rest of the global world. So for now, the sunset date is December 31st, but similar to how it was September 30th, it can always extend if the situation does not improve. We are constantly making improvements to the portal, and we are taking advantage of the slow season to train more persons to have the portal move quicker, because we would have seen throughout our previous experience that when there were many persons trying to get on the portal at once, it would go a bit slow. And so we recognized those difficulties. It was good in one instance that meant that there was a lot of interest in Anguilla and persons were trying to get here. But on the other hand, we know that our process is a bit longer than others, and we want to make it as seamless as possible. So we are arranging to see the possibility of making investments in making the portal run smoother and quicker. As you can imagine, that too comes at a cost. And as explained by the Permanent Secretary of Health, where we are as a government, we have to kind of weigh those costs and see what we can and cannot do. But we have an IT department that has been working with us hand in hand from August of last year, in preparing the portal, improving the portal, and making it to what it is today. And they are doing their best to improve how it's operated and ran. But I don't think at this point, based on our testing protocol and the way that we want to keep the temperature on persons who are coming into the island, that we would go completely automated like other countries, because those countries are ones that don't necessarily have the same epi situation that we have in Anguilla, and they're not necessarily minded to maintain that situation like how we have. So they have different objectives, and we have to be minded of what the reality we would like in Anguilla. We would like to, because of our health system, we have to do more than other countries to keep this country safe. So that's a long answer to say that we are doing the work to improve it, but we don't intend to have it completely automated, because we still need to have the benefit of check-in, especially as you see internationally, globally, there are persons who are making forges and saying that their status is one when it's another. So we have to make sure that we have that human element to safeguard the people of Anguilla.
Can you give us your thoughts generally on the closure of the tourism sector? We know that you've spoken about it, good feedback, positivity. We also know that the ATB, I'm not sure if they're still on the road or if they're wrapping up, but just a feedback generally about the tourism season and what you anticipate for the new season in October.
I think one of the great things with being in a region like the Caribbean is that we have close connections with our brothers and sisters in other islands, and most, if not all, of the tourism-dependent economies are saying that the numbers are looking up, and they feel like this new season will be a very strong one. But some of those countries are on the brink of lockdown, some of those countries have community-wide lockdowns, although they're still accepting tourists at some level. And so we know that it's particularly difficult. But together, we are all trying to ensure that the Caribbean is staying top of mind. And of course, in each country, you want your individual country to increase its market share and stay on top of mind. And so with the ATB being out on the road at this time is very important for us because they are expanding the markets that we are accustomed to being into, which is something that's very exciting for Anguilla. And with the introduction of American Airlines, who's also reporting strong bookings, that's something that indicates again that the season is looking up. I know that many persons are concerned about fees, the testing fees, and the impact that would have on the market. But we have an obligation, first and foremost, to keep the people of Anguilla safe and the people who come to Anguilla safe. And I've had the luxury of speaking to some tourists who've come to Anguilla during our tighter lockdown and those who have also come after July 1st. And one of the things that they're saying is that they're choosing Anguilla because Anguilla is a safe destination. So while we prioritize health and we are marketing that as something that's important to us, we are also seeing that we are being rewarded by travelers who would like to come to destinations, experience those destinations, and experience it in a safe way. So we think that the numbers are still good. Sorry, I would say one thing just to clarify. The testing fee of $200, it covers both tests. We have previously, each person who leaves this country have been paying $100 US for their exit test. So those costs are not the same, are not different, sorry. We're just allowing persons to pay it all at once, upfront upon entry. So they're paying for their entry test and their day 4 test, which can be changed earlier or later to act as their exit tests when necessary. So persons staying, let's say, 8 or so days or longer will not have that 4-day test amended for their extended stay. But persons who are staying for shorter times, it would more or less be the same cost that you have been paying previously, with the addition of the cost for the entry test. And it's an opportunity cost situation. It's either quarantine or take that test and no quarantine. So that's one of the ways that we are trying to preserve the industry for travel, where we increase our testing and reduce and eliminate the quarantine period.
Thank you very much, Parliamentary Secretary. If you'd indulge me for a few moments, I would like to share a few thoughts with you, if I may. An update on the constitutional town halls. They are due to begin on Thursday of this week. And the first one is starting in District 1, Island Harbor. And we're going to be utilizing, at this point, we're not sure whether it's going to be the church or the adjoining hall, but it will be in that area from 6 to 8. We have a people requirement of nothing over 25. And obviously there will be a number of us. So we estimate it's going to be about 6 or 7 technical people, including the Ministry of Home Affairs, and the remainder can be members of the public. So we're inviting members of the public to come out and participate. We are joining up with DITES, which is the Department of Information Technology in Anguilla, which is GAF, Titanium Sounds, to provide a robust platform, audio, visual, the whole works, that you can also participate via the social media experience as well. So certainly we're starting off on Thursday, and we really want to encourage persons to participate. There are a lot of issues surrounding this constitutional reform. There are a lot of concerns, and this is the opportunity, people of Anguilla, to get involved in this process. So we're looking forward to a very robust evening on Thursday evening over at Island Harbor, both online and via radio and other formats. And that's the Anglican Church. Yes. I just want to really thank the Minister of Home Affairs, my permanent secretary, Dr. Aidan Harrigan, and staff, and Vaughn and others over at DITES, GAF, and the others for collaborating to make this really, really worthwhile experience. We know we're going to have persons across the diaspora tuning in as well, so we really want to create a solid platform, and of course, Lloyd's Live, we're not leaving out of the mix as well. So we hope that you'll be part of that experience as well. The other thing I wanted to talk about, for quite some months, there's been a lot of speculation, innuendo, and talk about labor and labor being in bed with the properties, and the labor minister getting paid handsomely, and the labor minister going on and having steak and wine and so forth at the property. And in particular, I want to talk about a bit about Aurora, in particular, formerly known as Cuisinart, because I think it is getting to a point out there where I want to nip it in the bud. Because what I'm finding out is that persons are being fed a lot of misinformation, and unfortunately, this misinformation continues to gather wings and it continues to propagate. First of all, for the record, this labor minister is not in bed with any of the properties. They don't pay me any retainers, any under the table cuts or whatever. We treat all of them the same identical way according to the current laws of the land. But because Aurora has been singled out, I just want to share with you a bit of information. I would have gotten some statistics from the property, and I want to share with you. So on the operation side, so this would be like the hotel, the resort itself. On the operation side, prior to December 2020, we'd have had about 305 Anguillians employed down at Cuisinart, now Aurora, and about 2 expats, or what we call foreign nationals. That's about 306. Since December and onwards, they would have hired an additional 179 Anguillians and about 17 expats on work permits. So there's a total roughly of about 484 Anguillians currently there and about 19 expats. That's on the operation side. Now we have the construction side. As you know, that there are feverish attempts to have this property up and running by October. And it has become necessary to bring in a number of short-term consultants. And these have been in different areas. So we have the Wisherman Partners, which is the management group for the property. So they have a number of their executives come here from time to time to monitor and oversee what's happening on the property. Then we have a number of consultants who spending time at Aurora, training, coaching, and developing the local team and ensuring a successful operations. And so we've had to date about 15 of these that have been coming back and forth, and these are short term, sometimes some weeks, some maybe a month, but they're all short term. And then we have the construction consultants. And these construction consultants are working on the special construction projects and renovation of Aurora. And we've had about 13 plus of these. These numbers are varying because as the time goes on and the needs are changing, we may get additional requests from time to time for that. And then, of course, we have a number of US-based employees dealing mostly with the sales and marketing operations of the property. And in cases where we are getting requests for full-time permits, those requests are being accompanied by strict stipulations. Essentially, for each of those work permit applications, we have to be given a list of persons who would have applied locally, why is it they were not considered, and in cases where we are granting work permits, the understudy program. And this is something across the board, across the sector. But today I'm dealing specifically with Aurora. And then I wanted to share with you as well that there are quite a number of local construction firms that are employed, have contracts done at Aurora. And we have the construction team Synergy, and they have about 31 persons working there on the property under that construction team. Then we have Leeward Construction Company Limited, that's Leroy Gums, about 41 persons. We have Orchard, Romney, Beck and Associates, about 27 persons. We also have the Anguilla Garden Center, and they are doing the stuff for the hydroponics, the gardens, and the hotel. And we also have, I'm not sure I'm calling this right, MPITS or MEPITS, yes. And they're also one of the contractors down there. I was unable to get a number of their workers. But the point is, viewers, that there are a considerable number of Anguillians that are employed down at the property. And so when there is these allegations and insinuations that we are selling off Anguilla to the foreigners for work permits, that is really, really a far cry from the truth. And I just really wanted to set the record straight here this afternoon that we are looking out for the interests of our Anguillians, and those properties will tell you that whenever we have discussions with them, it is always, so you require this specific resource, what is in it for Anguillians? How can we get Anguillians employed in this sector? And we are very happy in the case of Aurora that they are launching their university, and we have Mr. Chris Richardson who is going to be heading that up. And the purpose of that is to train up the hospitality workers, bring them up to the necessary standards necessary for this 5-star resort. We really want to congratulate Mr. Schultz and all of his principals for the job that they're doing on there. So to really, as we say, rebrand and bring Aurora back, formerly Cuisinart, as a shining example in the tourism sector. So we certainly want to congratulate them on that. So that's basically what I had to say in that regard. I think also we need over at Four Seasons to congratulate Ms. Calla Gums as well. As you know, she was one of the persons that would have attained a prestigious Chevening Scholarship, and she's going off to study human resource management. And incidentally, HR is one of the absolute positions that in labor we say must be held by Anguillians. We don't compromise on that. And we are happy that there are quite a few Anguillians here that have undertaken the necessary training in HR as well. And this is one of the things that we will continue to stress in the hospitality sector, that positions of HR are held by Anguillians because they understand the culture, the people that work here, and they can best be able to meet the needs of the human resource of these companies, businesses. So that's what I had to share with you. Mr. Minister, Hayden Hughes, anything you wanted to update us on from your end?
Thank you very much, Minister. I don't have very much, just a quick update on the consultation process for the Carteret Boulevard. As you know, there's a lot of work that is going on at the moment. And I would just like to also apologize to anyone who has businesses along the area, make their living along the area for the dust. I know it's an inconvenience, but it's something that we have to endure for a little bit until we complete the works there at the Carteret Boulevard. We still have the completion date in mind, which is March of 2022. We have always said that, and we expect us to reach that goal. We also commenced this morning consultations with the various businesses along the Carteret Boulevard. We hope to have them wrap up on the 7th of September. But before that, dating back to the first week in June, we started a consultation and discussions with all of the stakeholders. That included Flow, Digicel, Dites, Anglic, Water Authority, and the like. So these are just individual consultations with each individual business that traverse the length of the Carteret Boulevard. We just want to have their input, also have some discussions with them. The discussions that we've had this morning went extremely well. We started with the Anglican Church, and I can say they were very productive. We're all on the same page. I think all of the stakeholders thus far have been very excited about the prospect of the improvements to that entire area. We've also had some initial discussions as it relates to improvement in the area of the Strip with the Social Security Board. We believe that the Carteret Boulevard, if you look at the value for money study that was conducted in 2012, that spoke to the Carteret Boulevard and the need for the development of the area. And the rationale for the development of the Carteret Boulevard isn't purely an infrastructural development, but it's an economic development, an economic driver for the city central area. And it's an economic venture in which we are embarking upon, because the investment in the center of the city is going to be very important as we try to develop and enhance the product. As you know, the Ministry of Tourism is also tasked with product development. So across the different ministries, whether it's finance and health, each one of the ministries intermingle with each other. And the development of the Strip and also the People's Market and the Market Square is going to be very important as we move forward. So all of these will be done in tandem. So when we emerge next year, the entire area will have a certain aesthetically pleasing look to it. There's going to be a number of green spaces. I know we spoke a lot about the tamarind trees, but also we will be doing a lot of planting of trees in the area. I've also reached out to the ANGUILLA Enhancement Project, which is a charitable organization that deals with not only planting of trees, but also cleaning up to see how we can also enhance the area. We'll have green spaces along the middle of the road and also in the roundabouts that will be developed, but alongside the sides of the roads as well. So there's a lot of work that is going on in there. We have some partners who have jumped on board in terms of the in terms of the provision of trees, and hopefully we'll have a lot of volunteers. And I'll be going through the social media platforms to write down every single name who have sounded the alarm relative to the trees, and I expect each and every one of them to be out there with pick and shovel in hand and to assist with the planting of trees. I think the Parliamentary Secretary spoke to the airlift that is coming to Anguilla. We are still having discussions with other airlines. We are still very, very hopeful and very optimistic that Caribbean Airlines will be coming to our shows in the latter part of this year. We have already seen a press release from Cape Air, and the Cape Air flight will be through San Juan into St. Thomas twice a day into Anguilla, and that's going to increase the traffic flow through the Virgin Islands and into Anguilla. So we're looking at all of the different routes in which we can capitalize on to elevate the profile of the Clayton J. Lloyd International Airport. Historically, we have not seen any more than 10% of our visitors coming through the Clayton J. Lloyd International Airport. We want to increase those numbers, even while we increase the numbers that are coming through Blowing Point. There are certain elements to all of these flights that we would like to see as well. We would like to see people coming to Anguilla and traversing to St. Martin as well, using Anguilla as a gateway to go to St. Martin, and not only going to St. Martin to come to Anguilla. And that will increase not only the traffic and the business opportunities, but the opportunities for the ferry boat operators when they come on stream. So hopefully that has given you an update. I did not mention, I wasn't here last week, but as you know, we have a new chairman of the board of directors of Anglic. As you know, there's a requirement for an annual general meeting every year, and we conducted an annual general meeting recently, meeting Anglic, and some members, they came to the end of their tenure, and 3 members was appointed. Every year at the annual general meeting, 3 members are retired and 3 members are added to the roster. And then the board of directors elect a chairman and a deputy chairman, and then they select the different committees, whether it's the technical committee or the finance committee or the audit committee and so forth, and persons serve on those respective committees. So the new chairman, as you now know, is Mr. Patrick Mardenborough, and the deputy chairman is Mr. Jibri Lewis. And we've already had discussions on where we want to move as it relates to energy in Anguilla. Anguilla has an abundance of sunshine, and it is something that we have been talking about for over 30 years. And I have full confidence in the board of directors that they will deliver on the promise of renewable energy integration. And I just want to say quickly before I close, some months ago when we came to office, we raised the issue of the Carito landfill and the fact that for well over a decade, the Carito landfill has had significant problems. As a matter of fact, when the airport was being redeveloped in 2004, the excavation that occurred in the Carito landfill against advice, professional advice, they dug into the aquifer, 6 feet into the aquifer. And by doing so, leachates out of the Carito landfill goes into the aquifer over there. And that is an issue that needs to be remedied. But apart from that, the residents in the area have been suffering tremendously from the different materials that are being taken to Carito. And this administration, we have not only spoken about it, but we have met with the residents of that area. And while it is, we do not have any short-term solution for that, we have an overall vision in how we can rectify the issues over there permanently. It's not a quick fix. It's not something that you go over to Carito and you spray disinfectant on. So it's not a quick fix. But we know where we want to go, and it's going to be a long road in order to remedy the problems over there. And I say that because I see a number of WhatsApp messages and voice notes going around about Hayden Hughes. And the fact that Hayden Hughes have not done anything about Carito. This is a new administration. This problem has been occurring for the better part of 17, 18 years. And yet, there's an expectation that within a few months, a problem that's going to take significant resources to fix is going to be fixed within a few weeks. And that is why when we speak about renewable energy, we also speak about reusable energy. And when we speak about reusable energy, one of the things that we envision is to have waste energy in the area that can rehabilitate the area and extract the garbage, if I may use that word, out of the Carito landfill to use for energy and to drive energy, but at the same time reclaim the land over there and clean up Carito once and for all. This is not novel, it is not new, it is not new technology. As a matter of fact, when Evan Gums was the Minister of Infrastructure, he had extensive public consultation on this very same matter many years ago, and it was soundly rejected by the people. And so it has come to the table again, and there are a number of countries, even in the region, that are doing waste to energy, whether it be Barbados or St. Bart's, or any of the other islands around the Caribbean, Singapore and the like. The United States, there's a number of proven companies, reputable companies that do this type of work. And this is one of the areas in which we believe that we can fix the Carito landfill. Short of that, we cannot relocate the Carito landfill to Island Harbor, and neither can it be relocated to South Hill or Shoal Bay. So we expect the Carito landfill to stay where it is, but we expect to be able to fix it. Will it take another year? We don't know. Will it take another 2 years? We don't know. We just don't know. We don't know how long it will take, but it's something that we are working diligently on a regular basis. It's not something that we talk about and then we forget. If you look and you peruse the email chains, you'll see that this is something that we discuss every single day. So it is something that impacts not only the residents of that area, but also Anguilla as a whole. And rest assured, we are working diligently on it, and the Anglic board also understands why it is that it needs to have a waste-to-energy component in the delivery of electricity.
Thank you very much, Minister Hughes. Oh, you have a question? Go right ahead.
A comment and a question. The comment is waste pickup. I just have to commend this island for the waste pickup here. Twice a week, at least in my neighborhood, it's just fantastic. I know there are a lot of places where it's once a week, maybe. So that's really a plus. However, driving around the island or flying over the island, there is an abundance of derelict cars sitting. Some in the bush, so you don't know that they're there and you don't care, but some you driving down the highway and you look and there's like 20 cars sitting. Are there any plans to ever do anything with those derelicts?
Yes, as a matter of fact, that is one of the directions in which we want to go. As you know, through the Vehicle and Road Traffic Act, there's a number of regulations that we're working on. Some of them hopefully will reach to the Executive Council this month. We have exhausted discussing those, and we'll be going to the public and public consultation on those. But as it relates to the derelict vehicles, this is something that we have spoken about quite a bit, and it also deals with product development. And one of the things that I do know about derelict vehicles in Angola as well, as much as it is a hazard, it's a politically explosive issue, in that everyone who has a derelict vehicle in their yard believe that the derelict vehicle can provide some sort of income from them, from selling parts. So that is why it has been politically explosive, in that over the years, respective administrations, including one that I was part of, did not want to touch it for that very same reason. But we have to go beyond just politics. And as you can know, this administration have not shied away from making very tough decisions, even if it means political, quote-unquote, political suicide. And that is something that we are working on. Mr. Tim Hodge, the Director of Social Security, in one of the public consultation, he raised that very same issue, and he made a very good point as to how it can be addressed. So that in itself is an idea as how it can be addressed. But before we go into any major movement towards derelict vehicles, it is something that we need to have some public consultation on, to have a discussion on, because we need to have the ideas of the people as it relates to that as well, because we don't have the monopoly on ideas. And however it is, whether it's a fee, whatever it is, those ideas we want to emanate from the people. I had another question that I needed to ask, and it relates to charging stations along the Carteret Boulevard. So there's a lot of provisioning that is being done along the Carteret Boulevard. Budgetary constraints will not allow us to do certain things, but we are putting in 2 bus stops, and in those bus stops there will be the provision for charging stations. Once, over the next year, hopefully, or the next couple of years, once we have sufficient funds, then we can complete the provisioning of the lighting, the charging portals, and so forth. But the groundwork will be done. All of the ducts and so forth will be in place. All the pipe work will be in place. That is being done as right now as we speak.
Thank you. Are there any further questions?
Yes, Mr. Minister, we are talking about doing this road. What about the buildings adjacent to this road, the access roads to the road that will be done? Some of those buildings need enhancement. Are there any way we are looking at that?
Those buildings are privately owned, and it's in everybody's best interest in terms of business to ensure that their business place is attractive. At present, we don't have the legislation in place to force people to enhance their physical look. But I do know that one of the things that we're looking at is how we can amend certain legislation to incentivize persons to enhance their buildings. But I believe that the fact that we are putting in this sort of investment in the Carteret Boulevard to ensure that businesses in the area, and we drive business to the area and drive tourists through the island, will incentivize persons to look critically at how they can enhance their own particular business so that they can generate more business as well.
Okay, coming to the derelict vehicles. The derelict vehicles. It's over 12 years now we have been talking about this, and we're ongoing. You put it aside, it's a political thing, but when are we going to come to some place where we're going to decide that these vehicles need to be moved? Because many of them storm up the storm. The things from the vehicle are also making the soil bad. So we need to look at that.
You won't get in an argument from me, and it's something that we have discussed, something that we are addressing, and something that we can probably come to the public with in either the latter part of this year or sometime in the early part of next year. But derelict vehicles isn't the only scourge that we have. We have a scourge of litter. We do a lot of littering on island. And even though single-use plastics have been banned since March of 2019, we still see a significant amount of single-use plastics hanging on trees and around the place. Also, there's the Litter Abatement Act that we need to strengthen. And you must also consider that right now on present on the books, there's legislation relating to trucks driving with garbage uncovered. And I have written to two commissioners of police, former commissioner of police and this present commissioner of police. I have met with this present commissioner of police to discuss the Litter Abatement Act and the enforcement of the Litter Abatement Act. And I have not seen any improvement whatsoever as it relates to these things. So some persons, and I often say this, right, because politicians get blamed for a lot of things. Oh, the politician is not enforcing the mask mandate. The politician is not enforcing the speeding regulations. The politician is not enforcing the Litter Abatement Act. Politicians legislate, but then there are technical persons who deal with the enforcement. Enforcement is not done by the Honorable Premier. You will never see the Honorable Premier out next to the side of the road with a speed gun in his hand, checking for speed. You will never see the Parliamentary Secretary running down a truck and giving them a ticket for driving their truck uncovered. You will never see the Minister of Home Affairs giving tickets and fines for violating the mask mandate. So what I'm saying is that those technical people, whether it's the Royal Anguilla Police Force or the technical people in each respective ministry who are tasked with the responsibility to enforce the legislation that have been passed by Parliament, that's where it stops. So I am not going to sit here and accept blame and responsibility. I take a lot of blame and responsibility for a lot of things that I don't even know about, and I'm fine with that. But I'm not going to sit here and take blame and responsibility for technical people, the Royal Anguilla Police Force, who are supposed to do their jobs and are not doing their jobs. Because even as the political directorate, we have no jurisdiction, none whatsoever, over the public service or the Royal Anguilla Police Force.
Okay, my final question is about, you said that the Anglic have just put together its board. And you know that we have been talking and throughout from the Eastern Caribbean Central Bank, and we've been talking about, and people who are going on board should have the necessary training. Have we been ensuring that that is happening? Because I think also the community college have a program for that.
I am very happy that you raised that, because this administration has ensured that and has enforced that. And at present, the only persons on the Anglic board that have not yet certified is the 3 new members and 1 existing member who is going to redo the board certification. But prior to that, all of the members were board certified, and the 3 members who are retired were also board certified. And that is not only the Anglic board, that is also the Anguilla Tourist Board, the Anguilla Water Corporation, and other statutory bodies. So we are enforcing as part of the requirement to be on these boards, that you have to do the board certification. And to your point, the Anguilla Community College have been working very closely with government to ensure that persons sign up and it's done.
Just on one point, we were talking about Corito earlier, and on July 6th of this year, Anguilla government successfully bid with the climate change program to access funds to complete a feasibility study to identify the technical and economic feasibility of the Corito landfill, the priority areas for waste management and dealing with waste at Corito. And we were able to secure £65,251 to have that study underway. The thing about not having your own funds is that you have to be able to explain the value of a project when you want to have someone else support it internationally. So this is step 1 in addressing the matter at Corito. And I think this will take a couple of months. And once that's completed, we then take the feasibility study to climate change funders such as Darwin, COP, and this same climate change fund that would have funded the feasibility study because they would have understood the difficulty that we're dealing with in terms of the health implications of having a landfill that's letting off toxic fumes, or what we presume to be toxic, at the very least, very foul scents, as well as the environmental implications of the toxins leaking into the aquifer. So this is something that's, while we don't have a defined date, I don't want that to be misunderstood as those steps are not being taken. One of the big difficulties we have in government is government's inability to fund this project ourselves. So we are doing the work to ensure that we capture the eye of the international community. And as you see, step one is already completed in that persons in the international community would have already identified the need for completing such a study as this. This project will be spearheaded by the Ministry of Health.
Thank you very much. We go over for the closing comments and final word to our Premier, Dr. Ellis Webster.
Well, thank you very much, Minister, and thanks for leading this press conference. Since I was running a little late, I would have brought up the study that the Parliamentary Secretary mentioned, and so thank you for that. You're reading my mind. Also want to say that the first dose vaccinations, persons who are interested should still register. We did mention that in the press release with the governor last week. So those who are interested as first-timers to get vaccinated, we encourage that, register, and based on that interest, then we would request more vaccines. Certainly, those persons who are in close contact with the vulnerable, such as children, and the elderly should, if they're not vaccinated, get vaccinated. I encourage that. In terms of, there was a question about mixed vaccines. ANGUILLA still does not accept mixed vaccines. That is, persons who would have gotten two different types of vaccine. And that is because Public Health England has not given us authorization to do that as yet, and certainly we wait on their guidance. Persons who have taken, say, Sinopharm or Sinovac, which is the Chinese vaccine, and then, I think that they would need to take, either the ones that are approved, that is Pfizer, Moderna, Johnson & Johnson, or AstraZeneca, to be able to come to Anguilla and be fully vaccinated as visitors. Residents of Anguilla are allowed to come back to Anguilla unvaccinated, but would have to quarantine for at least 10 days. And then the other thing I wanted to talk about was in the Ministry of Finance, the supplementary budget. We took that to Executive Council. That is where we look at the actual revenue and expenditure up until this point, and our projected revenue and expenditure, and then reallocated money for the expenses that we expect to incur up until the end of 2021. We do know that we will have a deficit because we certainly have not been able to bring in the revenue that was projected, that is a recurrent revenue. The expenditure is as it is. And so with that, with the reallocation, we still want to, the unemployment and underemployment benefit, which ended on the 31st of July of 2021, we want to, knowing that the tourist season has now slowed down, persons will become unemployed again. We want to see how we can help. And so we have tried to find funding to extend that at least on a month-to-month basis. Certainly it's difficult, but we are conscientious of the need to try that. of concern to us. Also, the ferryboat operators from Blowing Point to the French side of St. Martin, we know that they have had a very difficult time for the past year and a half. And we wanted to open up that route at the end of August, but certainly given the Delta strain and the high level of community spread and cases across the water, we have had to pause in that regard. But certainly we are looking into it. We have discussed different types of protocols. I know the question was asked earlier. So we are looking into that, how we can do it safely for vaccinated travelers, the testing protocols, the quarantining protocols for persons who would come in or who would do the day trippers coming back to Anguilla would still need some restricted movement and testing. So these are the things that we are taking into consideration. Caribbean Development Bank policy-based loan, we have requested that, and right now it's being it's for consideration, making sure that we are meeting the policies that we have negotiated with the CDB and the United Kingdom government, because of course having exceeded our borrowing guidelines, they have to give permission for any borrowing that we do. I did, it bothered me about the question on the duty-free masks, and I was racking my brain as to why that's not in place. And I think we go back to in December when we had there were the different items pertaining to COVID-19 that were duty-free, and we had expected, and so did the previous administration, expected, even with price gouging laws in place, that the savings would have been passed on to the people of Anguilla, and we found that $4.1 million was lost in duty for items that were brought in, and most of the stores did not pass on that savings to the people of Anguilla. And we in December 31st of 2020 had stopped that because we wanted to try to find some other way that we can ensure that the people of Anguilla would benefit from that. So that is probably where that happened. I have nothing against duty-free masks. I think that would be helpful, certainly. And so I will, along with the Minister of Economic Development, who is responsible for those issues, we will discuss this and discuss in Cabinet and Executive Council, see how we can make that happen for the benefit of the people of Anguilla. One of the questions that came up there is the MRI machine that was promised by Mr. Schultz from Aurora. And somehow I anticipated that question was going to come, Minister. I have spoken with Mr. Schultz. We looked at the possibility of a regular MRI machine. There was no space at the Princess Alexandra Hospital. There's no space at the Valley Health Complex for an MRI machine. To build a building for it was projected to be about $350,000 US. So that was not something that was feasible given the amount of donation that was going to be made. Also, we were required by any company that was providing an MRI machine, if you wanted warranties, that we had to have dedicated, I think it's some dedicated line you'd have to have. Right now, the CT scan at the hospital has to have the same thing, and that's down because there was an issue with that. They were recommending that we have to have a technician that can fix the MRI machine. So what we talked about most recently was a containerized MRI machine that would come in a container that, that was already with the MRI machine built into it. And so we're working on that right now. So we are in constant discussions with Mr. Schultz and his team regarding that. And also, he has an interest in having physicians coming to Anguilla to provide subsidized health care and what he calls a neighborhood clinic, one like the one he has in Naples, Florida. So these are ongoing discussions, negotiations, and we are still working on getting an MRI machine. And certainly we want to make sure that when it gets here that it's functional. And that's one of the issues that the MRI companies were concerned about, that we would have a dedicated line, that we would have MRI technicians. We certainly will be able to get persons, technicians who can run the machine, but we need someone who can fix the machine that would be available. And right now, with COVID, the travel, the restrictions, our CT scan at the hospital is down for similar reasons, that we don't have a technician that can keep it up and going. So those are, if anybody has any questions pertaining to any of the points that I raised, I'd be happy to answer.
I know we are stretched for time, so I actually have two quick questions. And since we are on Aurora, I want to ask Mr. Hodge a question. He mentioned the launch of the university. Could you give us some more information about this university to train the staff?
Right. So what is happening is that Mr. Schultz has realized that as part of the upgraded facility that he's putting together, there will also need to be a corresponding increase in the level of training and skills profiles of the workers. And as such, he has very smartly and innovatively created a university which is really going to be a training facility that is going to be able to upgrade the skills of the workers, and Mr. Chris Richardson is going to be heading that up. It is a really good idea. They are going to be partnering with other local institutions as well, the community college and so forth. So I think it's really going to be a win-win for us. Someone was asking online whether it's going to be extended to other sectors. We don't know at this point. I can't speak for Aurora, but I think primarily it's going to be geared towards upgrading the skills profiles of its workers in the first instance, and hopefully that could spread over to others. But it is something that I think we really want in the sector, because, I am new to the sector coming into labor, but I suspect over the years, the needs of the sector continually changes, the demands, and there's really a need for additional training to be able to continue to keep persons on the cutting edge, so to speak, of technology. Yes.
My final question to you, Dr. Webster. I know you gave us the financial outlook for the country, and you said we are entering next year with a deficit. But something caught my eye for the Executive Council minutes. Most of my questions were based on this. And it goes to number 9, which says, Council noted the new policies proposed to increase revenue, including new revenue measures, changes to existing structures, and GST. So I just wanted to know, what are the new revenue measures, and what changes are being made perhaps to the structures and GST, because we know that certain items were not being charged on GST, for instance, like education, health, in certain, and electricity up to a certain rate. So I'm just wondering, are there any changes to these areas?
What date are those minutes from?
Oh, August 11th.
Okay.
Just published last Monday.
Yeah. Nothing new that on the GST that wasn't presented in the House, or that's in the legislation. Certainly, fishing, farming, and manufacturing, those are going to be exempted areas. Water would be 0 rated. You mentioned electricity, a threshold up to the first 130 kilowatt hours. So yeah, that's where it is. Other measures that we're looking into, certainly foreign direct investment in terms of increasing revenue. And, the Minister of Economic Development, he will elaborate on those items that we are looking at, the MOUs that we're right now negotiating, sale of certain properties that are being negotiated, and also knowledge-based institutions that he's working on right now to get those on stream. And so I think that, there are very exciting times ahead. It's not all gloom and doom as the radio personalities and the social media, prophets may be stating. And so, I think that the best days of Anguilla are ahead, and I think, if we be a little patient, follow the protocols, get us through this, this recent COVID clusters, I think that we're going to be in good stead as we make it down to the fourth quarter of 2021 and the first quarter of 2022.
Thank you very much. And that brings us to the end of this press conference for today. We invite you next week, Monday. As the Premier also always says, if it's not a public holiday, it's always be on a Monday. See you next Monday at 2 p.m.